Sexually transmitted infections, STIs, remain a persistent public health challenge, and while innovative approaches like those at the Walk and Roar WIR Center in Bochum offer valuable support, they also highlight the extent of the problem. The increasing need for low-barrier access to STI testing and counseling reflects a worrying trend. Despite medical advancements, infection rates remain high and many individuals still hesitate to seek medical help due to stigma or lack of awareness. The fact that WIR provides anonymous notifications to sexual partners underscores how difficult open conversations about sexual health continue to be. When people rely on an impersonal SMS or email to inform past partners of potential exposure, it raises concerns about the societal discomfort surrounding STIs and the potential consequences of untreated infections. While the integration of medical, social, and psychological support at WIR is commendable, it also exposes a critical weakness in the broader healthcare system, namely, that sexual health is still not adequately addressed in standard medical settings. The need for a specialized center that coordinates efforts between doctors, public health authorities, and advocacy groups suggests that general practitioners and other healthcare professionals are not sufficiently equipped to handle these issues on their own. This raises questions about gaps in medical education and whether the current healthcare structure effectively meets the needs of patients with STIs. A particularly alarming aspect is the role of the internet and dating apps in the spread of STIs. With 70% of WIR's patients reporting that they find sexual partners online, digital platforms have become a significant factor in STI transmission. The anonymity and accessibility of online encounters can make it easier for infections to spread while making it harder for individuals to trace potential sources of exposure. Although WIR has introduced online risk assessment tools and self-testing kits, these are only partial solutions. They may increase awareness and detection, but they do not necessarily address risky behaviors or ensure that individuals receive proper medical follow-up. There is also the risk that self-testing could lead to misinterpretation of results or delays in seeking professional care, which could allow infections to spread further. Another concerning aspect is the high prevalence of trauma among WIR's patients, with approximately 50% having experienced some form of trauma. This suggests that many individuals engaging in high-risk sexual behaviors may be coping with deeper psychological issues, further complicating prevention and treatment efforts. While the availability of trauma-focused therapy at WIR is a positive step, it also indicates that STI prevention cannot be separated from broader mental health concerns. Without widespread mental health support and education, efforts to reduce STI transmission may not be as effective as hoped. Despite WIR's successes, its existence highlights systemic failings in STI prevention and sexual health education. The fact that a single center is handling such a large patient volume suggests that similar services are lacking in many other regions. While WIR's collaborations with schools and youth organizations are promising, reaching only 800 students in a year is far from sufficient given the scale of the problem. Sexual health education needs to be more comprehensive and widespread, starting at an earlier age to reduce misinformation and stigma. Ultimately, while WIR represents an important step forward, it also serves as a reminder of the ongoing challenges in STI prevention and treatment. The high reliance on digital notifications, self-tests, and specialized centers suggests that broader systemic changes are needed. Without a stronger emphasis on education, open communication, and accessible healthcare, STIs will remain a major public health concern, with long-term consequences for individuals and communities alike.